Tonight, the state is backtracking on their own plan that clearly lays out doctors may soon have to decide who lives or dies inside our hospitals. State leaders now saying hospitals are not triaging patients, something we would see in a war or mass casualty situations. ABC 15's Nicole Grigg is in Phoenix tonight with this clarification coming 4 days later.
The state didn't give a lot of details in the press conference on Monday about activating its crisis care plan. So what we know is from the detailed documents that they provided, and that's where it lays out the scorecards and who gets what level of care.
This week has been the worst week of the crisis in the emergency department so far. It was worse than the last week, which we thought was the worst week.
Dr. Frank Lavecchio on the front lines on just how bad it is in our hospitals.
When you walk into work, all the beds are full in my ERs. And when I say all the beds are full, they're with people who have COVID who are waiting to go upstairs. Much of the problem is upstairs is full.
As hospitals are trying to expand capacity, on Monday, Dr. Kara Christ gave her approval to activate the state's Crisis Standards of Care Plan. It's a plan based on algorithms that involves ranking or weighing survival and recovery chances to help doctors decide who gets what priority care and life-saving resources like ventilators and who doesn't.
This is the first time that I can think of that there's ever been a declaration of crisis standards in a systemic way.
Will Humble, the state's former public health director, telling us this crisis care plan is to help make the tough decisions in a uniformed approach.
And that means there will be patients that are in such a condition that you just can't offer that ICU service to that patient when you know that there's another patient that might actually live.
Dr. Kara Christ saying this on Monday.
A lot of states actually have activated their crisis standards of care plans.
But is that true? A new column in the LA Times saying Arizona's rules for rationing healthcare should terrify you. They also say other states activating plans appears untrue, saying, quote, though most states have prepared a crisis plan, no others have activated it. Arizona's former director of emergency management.
I believe, because I've not heard anything otherwise, that Arizona is the only state that has so far implemented and activated their crisis standards of care plan.
The plan activated on Monday, days after a disaster committee made up of healthcare leaders across the state requested it. Dr. Christ approving that very detailed plan, saying then
it gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those. The other thing that it does, though, is it also gives their healthcare workers some liability protection.
And then today, 4 days after it was implemented, Dr. Chris saying in a statement, quote, I can confirm that no hospital in Arizona is triaging care to patients. This a day after the vice president saying he didn't seem to know such a detailed plan was approved.
I must tell you today, I can't account for the reports that you cite.
Dr. Chris went on to say, quote, our activation of the Crisis Standards of Care Plan was to address the recommendations from the State Disaster Medical Advisory Committee, including to ensure hospitals prepare for staffing and activating all licensed beds and all surge beds. But that surge line has been available for weeks.
So that surge line has been in place to move those patients that require higher levels of care between facilities.
As for that crisis plan in place for doctors,
I hope we never have to resort to limiting, care for someone.
Two of Arizona's largest hospital networks, Banner and Dignity, both telling me that they're in the surge mode of that detailed plan. I asked the governor's office if Dr. Birx or if the vice president were concerned about the state activating this plan. They said the assertion that Arizona hospitals are deciding who lives or who dies would concern anyone, and reiterated again that Arizona hospitals are not triaging patients. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.